the past few months in the Washington, D.C., Maryland, and Virginia areas, the Black and Brown, queer, transgender, and non-binary communities have experienced multiple different losses to substance use. Individuals directly and indirectly impacted by this issue all came together as a part of the National Trans Visibility March's Community Advisory Board to create a campaign to raise awareness about this issue. Those individuals created a campaign titled Our People, Our Purpose. The message behind this campaign is meant to promote the necessary community that individuals need, family, chosen family, biological family that individuals need in order to make sure that they stay safe.
It would mean unity, and it would mean change. It would mean change because the one thing that's the problem in our community is division. And coming together, we would make such a powerful impact on the world as a whole, just being one.
When I say trans, you say power. Trans 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 power.
Well, hello, everyone. Welcome to this amazing panel that's part of the National Trans Visibility March's week of programming. My name is Josh Bell. My pronouns are he, him. I'm the executive director of One Orlando Alliance, and it's our privilege to be the local host organization for the National Trans March, bringing it here to Orlando. And I am here with an amazing panel of leaders that are based right here in Orlando, and we are excited to share with you about this crucial topic of trans-competent mental health care. The purpose of the National Trans March is to raise the visibility of the transgender community, to empower, and to support. And so the purpose behind this workshop is to make sure that our transgender community members have the mental health care that they deserve. And these providers and representatives are going to share a little bit more about that. So everyone's going to introduce themselves today, and we're going to go ahead and start with Xander.
Oh, hey, thank you so much. It's great to be here. Thank you for the invitation to speak with you today and with this great cast of folks. I'm really looking forward to hearing from all of you. So I'm an Orlando-based licensed clinical social worker. My name is Xander Kegg. Let's see, what else can I say about myself? I'm 55 years old. I'm a trans man. I'm a first-generation American. I'm also a first-generation college graduate. Like both of my parents, I dropped out of high school, but I eventually found my way to college, thankfully, at age 30. And now I have, advanced degrees and can do the work that I do. I've been married for 19 years. I started my medical transition 16 years ago, so we were together for 3 years prior to that. I have several published books, specifically around trans male identity and experience. And if you're at Pride this weekend, tomorrow, I'm going to be at the American Transgender Resource Hub booth. So please come say hello and check out all of our resources.
Thank you so much, Xander. We're glad you're here.
Thank you.
Nicole, would you like to go next?
Sure. Hi, everyone. My name is Nicole Parker, pronoun she, her, and I am the Director of Transgender Equality for Equality Florida. I'm so excited to be here sharing space with you all today. A little bit about me. I am coming up on the 10th year of my transition. I left my house at 19, kind of took the rough route, but I was able to kind of loop back around and get my life back on track. My advocacy journey started right after Pulse. Pulse was a place for me that I went frequently. It was one of the first places that I presented as Nicole, and truly be myself. And after that experience of having your safe space taken from you and losing friends, that's when my advocacy journey began. And, a lot of things were uncovered after the Pulse tragedy, but one thing was that there was not much trans representation in town. And looking back, 5 years later, it's beautiful to see so many of us took a seat and pulled it up to the table and started advocating for our community. And mental health is something that's very important to me. I believe that we are taught to keep what's in here, and that's not necessarily the most safe. Talking to someone is so amazing and can really help you get through things. So I'm excited to have this talk today.
Thank you so much, Nicole. We're so glad that you're here. Ace?
Thank you so much for having me. So I'm Ace Davis. I am the program manager at Bliss Cares. So a little bit about me is I'm 29. I am in Orlando by way of Philadelphia. So I have been medically transitioning coming up on 12 years. I live here with my fiance, Aubrey, who's a performer in the community. You may know her as Melanie Von Cruz. And so, yeah, I'm a trans man. I use the word transsexual to describe myself. And I'm happy to be here. Thank you.
Thank you, Ace. So glad you're here. And Stephanie?
Hi, everybody. Good morning. My name is Stephanie Preston Hughes, and I'm a Florida licensed mental health counselor and national certified counselor. I have a private practice in town, and so a majority of my clients are within the LGBTQ community, and I work quite a bit with transgender clients, both through transition and then also with non-transition related issues in terms of just general mental health care. And so what I've noticed in the years since I began working with trans clients at the University of Central Florida on the transgender care team is that there's a lot of competency issues out there among providers. And I didn't realize it was as bad as it was until I became a little bit more competent and saw ways that we could really improve. One of the biggest things that opened my eyes was in 2015, the National Center for Transgender Equality did a national survey on trans health and transgender needs, and a staggering 39% of transgender respondents reported experiencing serious psychological distress in the month prior to completing the survey, compared with only 5% of the non-transgender population. So clearly that data tells us that we've got some work to do to better meet the needs of our trans clients, and also what can we do systemically to keep that trauma from happening in the first place. So I'm very glad to be here.
Y'all, I am just so honored to be in the same virtual space with you. I see your work in the community. I see the ways that you're making things better, and the chance for us to talk about this important topic and for you to share your experience and your skill is just a beautiful thing. So thank you for that. And if you're joining us a little bit after we've started, we're glad that you're joining us, and we want to invite you to share this video on your social media so that more and more people can get this valuable information, whether that's sharing it on your personal page or your organizational page. We don't want anyone to miss out on this really, really important content and conversation. And so we're going to start out with the reality that there are unique mental health care needs for transgender folks. And there are barriers, significant barriers, to getting the mental health support that they need, that our community needs. And so Nicole's going to start us out on that.
Thank you, Josh. Mental health is complex in its own. And I think it's something that's not talked about enough. And we're taught as humans to, keep whatever's going on in our brain. And, if we're thinking outside of the box, we're crazy. Or if we're thinking about something in a way that other people don't, we're looked at as different. And all of those things kind of create this society of not wanting to go get help. And when you finally do, it's such a liberating and amazing experience, but it's about actually getting there in the first place. Communities of color, we're taught to keep family business in the family. You're actually looked down upon if you go to a counselor or if you talk to someone about anything that's going on. But it's up to us to really break that cycle, because that's what's been happening is trauma is passed down through generations, and we're holding it in, and all of our trauma, microaggressions, and everything that comes in that is all just festering inside of us. And I was one of those people in the beginning. when I first transitioned, I didn't think I could talk to a counselor. If I'm being honest, I didn't have it the easiest in my transition. I was doing sex work. I was taking black market hormones. I felt I was going to go to jail if I told a counselor that the way that I make my money is sex work, not realizing that, counselors are safe spaces and things like that. And that was what I had to learn. And in my advocacy journey, that's what I try to do, is get people to understand that you can talk to someone, and having someone validate your feelings and give you just constructive criticism, which could be hard to take sometimes. And we all know that, but it's needed. Us as humans, we're always evolving. And just being able to go an hour or 2 hours a week to just talk to someone can really change your whole life. And even if you have family or friends telling you, don't do it, don't talk to people, I would say push through it. Try it just one time and see how you feel. And if it doesn't work for you, so be it. But you never know unless you try. Barriers, when it comes to barriers, there's a lot. There's many counselors that just want to help people, but it's about knowing how to truly help who you're talking to. So for instance, I had a counselor early in my transition. I still never forget it 10 years later. I went to go see her and we're talking, and she asked me, who are my idols? And at first I'm thinking like, I don't really know, but I was like, oh, I look up to this person, this person, and this person. And the counselor went on a 10-minute tangent to explain to me that the people I looked up to were drag queens, were men in wigs, and that I need to find trans idols to look up to. And I'll never forget, I was of age, I was well of age. I remember leaving like, I'm never doing this again. Like, that is not the experience that I wanted to have. However, working in a mental health agency, I knew that there are amazing counselors out there. I know that there are competent counselors out there. So there's a lot of barriers and a lot of people want to help. But I think the last thing, one thing that happened to me when I was 15, told my mom that I wanted to transition. She took me to a counselor. The counselor sat down and asked me, so tell me about yourself. And I said, well, I think I'm trans. And she goes, okay, I'm going to have to refer you out because that's not something that I personally know about, but I can get somebody to talk to you who does. And at first I was offended. I thought like, oh, great, I'm one of those, they can't talk to me. Now as an adult, I realized how powerful that was. She understood that she couldn't help me and wanted to send me somewhere else. So long story short, just understand that counseling has many great benefits, and please don't shy away from it, even if you're scared.
Yeah, that's thank you, Nicole, for sharing your story. It's so powerful. And when we enter into that counseling and supportive space, it is meant to be a safe space, right? And it's meant to be a space that we're very vulnerable. And therefore, if someone doesn't handle it well, it can be very harmful. But what in terms of we were kind of talking a little bit about that recipient's side of things, where you're processing it as someone who's going to counseling. But Xander, you've had experience on both sides of that, right? Or primarily on the provider side. Would you share more about that?
Sure. I can really think of, pros and cons, so to speak, when it comes to being a provider and a consumer at the same time. And I don't say consumer meaning like, because I've gone to gender therapy. I actually have not gone to therapy around gender identity issues, but because I'm a member of the trans community. And so I'm interacting with trans people all the time. So I consider myself a consumer in that sense, and that I'm consuming trans services and trans care that's being provided. And so what I notice from within the community, some of the issues that come up have to do with anybody who's a mental health provider and is working with anybody in the trans community will often get labeled as a gatekeeper, right? And this is a pejorative term. This is a negative term. This is you're bad, you're wrong, you're doing something wrong. You're putting up a block. You're an obstacle, right? You're a keeper of the gate with a big padlock on it. And what I want to say to people is that although not all of us need psychotherapy as part of our gender transition and gender awareness and navigation process, I think as a social worker in particular, I think it's important for all of us to have somebody assess our readiness and our preparedness for what's to come when we embark on a medical transition in particular, because hormones do a lot of really powerful, crazy making things, right? And so do surgeries, and the way people see us and treat us as a result of those changes, those differences, we might not be prepared for. We're probably not prepared for that. I know I wasn't prepared for being treated as a man in society. Even though I had been a very masculine woman, I was a member of lesbian community for, over 25 years. I was not prepared for how the world was going to treat me when it saw me as a man. Taking testosterone didn't bring that preparedness. I needed more support around that. So I probably could have benefited from going to a therapist, but similar to Nicole, I had my own negative reactions to going to therapy. This is before I became a licensed clinical social worker. On the other side of things, some of the cons around being a consumer provider that I see is that the non-trans people, whether they're in our community or not, meaning in the professional clinical community, mostly not. As a trans person, I'm just considered too subjective, right? I'm too close to the issue. I don't have enough distance from it, so I can't be objective, right? I can't see things without having my own, pink lenses on, my rose-colored glasses, my rainbow-colored glasses, so to speak. And, what I want everybody to know is that's not going to necessarily be true. It's definitely not true for me. I'm quite the heterodox thinker. As a matter of fact, I speak about really controversial, taboo topics all the time. I'm not a favorite person in some people's minds in the community as a result of that. I don't care, right? Because I'm a human being first. I'm not a trans person that has to oblige by by orthodoxy. So I'm not too subjective. Some people might be too subjective. So I think I want to be taken on a person by person basis. I think other people should take us on a person to person basis as well. And I think we should take all of each other on a person to person basis. We're all not living the same trans life. That's for sure.
That's so powerful, Xander. Thank you for that. And yeah, we all deserve to be treated as ourselves, right? And as our full selves, and not diminished or judged in any way. And that's the world we're definitely working for, right?
Well, in our authentic self. I mean, that's what everybody champions, right? We're becoming our authentic selves. And then to have somebody sit back and say, well, I don't like your version of authenticity is quite offensive.
Absolutely. And something that you said stuck out to me, where our trans experience is not the same. I think people put us in a box that all of us do this and all of us do this. And it's like, no, some people don't medically transition. Some people do. Some people have surgery. Some people don't. It doesn't matter. And, I had like the old school girls transition me, and they had that mindset of like, if you don't have breast implants, you're not a woman. If you don't have this, and it's like, that's all physical stuff. My soul, my energy is of a woman, and that's just what it is, and I celebrate how anyone wants to express themselves. That's the beauty of life. If we all look the same, how boring would that be?
Right. And we're not all the same religion, or we don't all reject religion. We're not all the same political party. We don't all come from impoverished backgrounds, or, like we're very different. We're a microcosm of society. And so I think it would be better if people saw us in that way.
One other thing I'd like to add, in terms of like a trans person seeking mental health care and being a trans provider is, in so many clients I've worked with who've landed with me after trying to work with other providers who maybe weren't as competent, it was automatically assumed by the provider that the reason that they were seeking services was related to their transgender identity. And so if I could have really one big takeaway that mental health providers watching this have, it's that don't assume that when a trans client, a trans person is reaching out, it's about that. I have worked with several clients who post-transition went through a little bit of a slump or a depression because there was so much energy rightfully focused on that, but they needed some guidance sort of with career direction afterwards. So there's a lot of other things besides acute crisis or just transition that we can support transgender clients with.
and this could be me personally, but one thing, if you're a provider and you have a trans patient, especially if it's the first couple times, just ask like what's going on in your life versus I've had counselors, so how's your transition going? And I'm like, what if I wanted to talk about a breakup? You know, like I don't want to talk about that necessarily right now. So kind of don't lead in with like, if you know I'm trans, leading in with that piece, lead into just connecting with me as a human, and I promise we'll get there.
Yeah.
I agree with that, Nicole. I have had some negative experiences, mostly negative, honestly, with mental health providers, but the most recent one has been wonderful. And we have not spoken about me being trans whatsoever. It hasn't even come up. So it's wonderful.
Mm.
And I think she's waiting really for me to bring it up and as I want to.
Well, and that is so valuable, like meeting people where you are rather than assuming we know what the issues are. I mean, that's good for mental health providers. That's good for all of us, right? Like,
Yeah.
okay, this is the thing that I know about you. Well, everything else must be connected to that, and this must be your primary issue or concern, right? But what do you think, Ace, you started to talk about this a little bit in terms of kind of evaluating that space of competency? Like what gives you the feeling that, hey, this provider gets it? This provider is someone that is safe and someone that I want to keep seeing.
So I want to start off by saying that I think that it greatly differs based off the person themselves. So everything that I can say really is just from my own perspective. So I think that for me personally, I had to go through, unfortunately, negative experiences with providers to really find what I needed and what I was looking for. For instance, I had a similar experience to Nicole back when I was around probably 13, 14, 15, that time range, with a mental health provider who, a little different than Nicole though, she told me she couldn't help me and kind of just left me there without any resources. And so at that time I was self-harming, and she really didn't even address that either. She just kind of said, you got to figure it out. And as a child, that was really difficult. And I mean, I grew up in a really rural area. I grew up in Southern Maryland, and there really weren't very many resources. It was, you went to the county hospital or there was nothing else. So in her defense, I don't know that she had the resources to share with me. So, you know, in addition to that, I have had some other experiences with mental health providers. One of them, I went in and it was for an untrans related topic. And he initially started off by wanting to do kind of like a background on family related stuff. And in doing so, he wanted to ask me what my name was previously, which had nothing to do with why I was there. And I said to his face, well, why do you need to know that? And he was like, well, I just want to know so I can get like a full picture. And I said, but you'll never use that to refer to me. So why do you need to know that? And he kind of just backed off a little bit. But so I say all this to say that I think I've just had to learn from experience again. So I think in order to make someone trans competent as a mental health provider, I would say it really starts with, to me, where their heart is. If I can tell that they're coming from a positive place, and I think also if they are putting the work in themselves to educate themselves, not relying on the community to educate them. And also, I know we'll talk a little bit about this later, but making sure that they, as a person, stay relevant in terms of like keeping up with the most current language and with the most current way to help folks through their transition, if it is trans related mental health care. So I know I want to talk a little bit about how to find a trans competent healthcare provider. So I would say there's a couple different ways. So firstly, I find that folks just talk to each other about them. I think that, you know, I know that there are some issues still within our community about talking about mental health care, but I feel like when I compare what my community is saying to like my mom and like her friends, we definitely talk about it more often than other communities. So I think that's the biggest place to start, is talk to your friends. I know there's a lot of resources online in terms of, if you have Facebook, there's a lot of boards, there's a lot of groups that you can talk to friends about, because unfortunately, you can go online and you can go on psychologytoday.com and you can click transgender as someone that's competent in that. But that doesn't necessarily mean that they're competent. It means they have experience working most often with trans folks. It doesn't make them competent, unfortunately. I personally have found that therapy den is another resource online. I found that I've had more success through that website. That website has a lot of different demographics or needs or what you're looking for out of therapy that you can select. And then I know that Southern Equality has a resource as well if you are in the southern states. They call that, I think it's Trans in the South. They have mental health providers on there, hormone providers, all sorts of things. And I imagine, Nicole, maybe you all have something at Florida Equality Florida, excuse me, as well for folks. And then I did want to touch a little bit about access to mental health care being an obstacle as well in our community. So often folks don't have health insurance that they can use to see these providers. And if they do, sometimes they're not networked, that sort of thing. But as Bliss, I wanted to talk a little bit about one of our resources here. We have a program that we call the Subsidy Program, and what we do is we assist folks with the cost of their health insurance. And then in addition to that, I also have a passion for health insurance, which I know sounds really strange. No one really has a passion about health insurance. That's silly. But I'm really passionate about it, and really, when I say that, I mean passionate about making sure that trans folks specifically have access through their health insurance policies to the care that they need, whether that be mental health, hormones, surgery, etc. So in addition to helping folks enroll into insurance, which again, we're helping with the cost of, I also am really interested in and welcome anyone who already has health insurance and maybe wants me to review their policy and help them kind of figure that out as well, navigate the health insurance side.
I wanted to piggyback on something really quickly that A said about if you go on certain websites and people have indicated that they work with the trans community, and so it may appear on there because they have the experience. It also might appear on there because they say, sure, I can work with trans people. So you need to vet those people. Most clinicians will provide a 15 to 20 minute free consultation, and it's during that time period that you ask them. You don't have to go to a paid session to ask them those kinds of questions up front. You can do it via a telephone call or a quick video chat or an email, whatever format they're offering. I would like to mention, total disclaimer, I'm an instructor and mentor with WPATH, but WPATH also has a provider directory where people can find, not only behavioral health specialists, but all of the other like primary care and hormones and surgeries. And then there's also, in addition to Therapy Den, there's inclusive therapists. That's also a good directory of therapists across the country that say that they work with LGBTQ community, and you can find one that specifically is working with trans individuals if that's what you're looking for.
That is such an important point. And as a therapy recipient myself, if someone had told me that when you meet with a clinician, you're actually interviewing them and figuring out if this person's the right fit, like we get to self-advocate and we get to say, is this person someone that's going to be safe for me in whatever aspect? And that sometimes another barrier to access is that feeling this person's the expert, this person's highly educated. I just show up and they tell me what to do. But there's also the chemistry check, and there's this figuring out, does this person really have their heart in the right place for me? Is this person someone that I'm going to be able to open up to and do good work with? Those are all excellent points. And definitely the access and the insurance, and Ace, what you said about growing up in a rural area where there aren't as many resources. Fortunately, we have a lot of virtual options now, but yeah, those are all elements that can keep something, keep someone from accessing the care that they need. And along with that, we're talking about therapy because we believe that it does often make a positive difference, right? And so let's reflect a little bit on what that positive difference can be. What kind of improvement can people expect, or support can people expect as they enter into a relationship with a mental health professional?
Yeah, I think so. We've obviously spent time talking about some of the challenges we've had, but it's important to also highlight the beauty of mental health.
Yeah.
I'm an open book. Everybody who knows me knows this, so I have no issue talking about this. I originally started going to counseling to process the sex work that I experienced, that I'm still to this day in counseling for that. And it's through that, you go through different subjects. Obviously, it started at that, and then it went through different parts of my life. But I will really say it's allowed me to become grounded and comfortable in who I am. When we're transitioning, we're worrying about, you know, a medical transition, a social transition, mental health, physical health. All of these things are coming into play on top of your work, your social life, everything. Sometimes we can kind of put things on the back burner. And it's really allowed me to be comfortable in myself. I think in the beginning of my transition, I felt I needed to be a certain way. I needed to present a certain way so people knew undoubtedly I was a female. And now I'm just not in that space. Now I present how I want to present. I'm not so worried about that. And counseling really helps me to get through that. And I'll be honest, counseling has helped me to process how life treats trans folks sometimes. Like, it's not the easiest, even though it's 2021 and so much has changed. There are still times I go out and people will say that's a man or this and that, or make comments. And I'm a human, even though I can brush it off, you know, I know how to do that. That doesn't mean that I don't think about it. And counseling really helps me to get that out, because holding it in is really not the most healthy. So whether that's a counselor, whether that's a friend, just whoever that you have, being able to kind of get those feelings out really help you kind of on this journey.
So I know I talked a little bit already about the current therapist I'm actually seeing, and her being awesome and making me really comfortable by not making trans be the center of the focus. But a little bit more about her specifically is that she's the first therapist that I've seen that, like, I explained my experience to her and she like acknowledges that it was difficult. Like, usually they just kind of bypass it, but she's like, wow, you've been through a lot and look at where you are, kind of thing. And that really has helped me a lot, because I feel like oftentimes we kind of, I don't know, belittle our experiences or make them like, oh, it wasn't as bad as it was. And so for someone outside of myself and outside of my close group to recognize that was really, really powerful to me. And change my perspective. Also, when I started my transition medically, at that time, they were requiring that I go through group therapy to be able to start hormones. Now they just do informed consent. But at that time, it was actually really interesting because I did not think that I was going to be able to get anything out of the group, because everyone in the class, or group rather, of therapy was all trans women, and then there was me. And so I was like, well, I'm just going through this because I have to go through it to get through it, to be able to get to testosterone. And so I actually, through that process, made a really good friend. And even though she's a trans woman and we have very different experiences in how we move through the world, our experiences are similar. And it's really been great that we don't talk every day, but at this point in time, we still check in with each other and we're still really good friends. And so I really appreciate that part of group therapy. I guess it's another part kind of goes into mental health care, but it's not through like professional services. I find that I'm in a lot of groups, even if it's in person or if it's online, and it's just like groups of other trans people. And I found that that's really more helpful than anything that I've experienced. I have Xander as a friend. I have a group that I'm in online that's for trans men who have been in transition medically for more than 10 years. And so it's really nice to be able to get into those settings and be able to, I think we share more in those settings than I've ever shared in any group setting. So I think that really just having a group of people that have your back, that you can really tell anything to, can be really impactful, even if it's not from a professional mental health perspective.
I wanted to pull back the curtain a little bit for those of you who aren't clinicians and are working with somebody now you're not really thrilled about, or you're thinking about working with somebody. And just know that, again, like trans people, we're not all the same either as clinicians. There's what are called theoretical orientations. That means that every therapist has a different way in which they theorize and they orient themselves to the types of therapies they're going to be doing. So you're going to have people that take what would be considered like psychodynamic. I'm not going to go into the details, but look these things up, right? Psychodynamic perspective on how they interact with their patients or clients. There are going to be people who practice a particular kind of intervention model or a therapeutic style, like say cognitive behavioral therapy or CBT or dialectical behavioral therapy. I would imagine that ACE's therapist is a strengths-based therapist because she acknowledged, you know, the journey he's been through and the difficulty of it, but then said, and look at you now, look how far. Like, that's a strengths-based perspective. Not all therapists are strengths-based. So just know that, you know, when you're interviewing your therapist, you can ask them questions like, ask them, look it up first so you know what you're asking. What's your theoretical orientation? What particular styles of intervention or therapeutic techniques would you use with somebody like me with what I'm dealing with? Find out, you know, because it's not like you're just going to go in and have a casual conversation. There's something behind that therapist. It's our training, it's our experience, and our value system, which also ties almost always directly with our theoretical orientation, right? So find that out about your provider. First, look it up so you know what it is, and then ask them about it so that you know that you're matching up with somebody better than not. So you don't have a bunch of negative experiences with therapists until you find the right one.
I think that's a great point, because I think people just think therapy is therapy, and they don't really think that there's anything else to it. And I personally had that perspective up until recently as well.
Yeah, and I would offer, you know, as a cisgender woman, cisgender white woman who's been a therapist for 20 some years and had no education training about working with transgender clients or even GLB clients for that matter back in 1990 something. It's really critical that as mental health professionals, we receive ongoing training. We are required by the state to earn continuing education units to keep on top of practices in the field. And so one of my encouragements is for providers, even if you don't think that you're going to work with a transgender population heavily, you have a responsibility ethically and professionally to know enough to not do harm to somebody who reaches out to you for a consultation or comes out to you during the course of treatment related to other mental health concerns. And so it's really critical. We forget, I think, sometimes in the seats we sit in, how much power we have and how much potential harm we can do. You know, our first ethic is always do no harm and then always try to do good. So please, even if you think you know what you need to know about trans mental health care, there's some really wonderful virtual trainings available from professionally reputable organizations. I'll plug a couple. The Fenway Health Institute is fantastic. Also WPATH, I know Xander can give a plug there. They have something called the GEI, the Gender Education Initiative, and they specifically train individuals, mental health professionals, medical professionals, to 40 hours of intensive coursework, case analysis to really understand how to work with clients on all kinds of ways. Communicating with medical providers on transition, that might be a task of the counseling care they're coming for. Talking with family members. So there's a lot of complex things for providers working with trans clients we've got to be thinking about. So like folks have said, it's not just let's sit down and talk about being trans. There's some real skill here. So it's not too late to learn.
One more thing I'll piggyback on with that, Stephanie, is another sort of behind the curtain is we all go through very different trainings in our school programs too. Right. So Stephanie is a licensed mental health counselor. I'm a licensed clinical social worker. There are also licensed marriage and family therapists and licensed professional counselors. And then there are also licensed psychologists. We all get very, very different training where our school programming is very different. Our internships are typically different. Right. As a master, as a social work student, my training was mostly in clinical case management, crisis intervention. I wasn't trained in any of my internships. I did 2 of them during my 2 years of my schooling. I wasn't trained to do psychotherapy. I wasn't trained in the one-to-one or group therapy. You know, I did psychoeducation, which is different than group therapy. But I would imagine my wife is an LMFT and she does work with trans people, you know, licensed marriage and family therapist. She spent her whole schooling and all of her internship learning to actually be a psychotherapist. And so we used to compare notes because we're going to school at the same time about how really different, like the code of ethics are different. The lens that we use, right? The way social workers see individuals and see the world is very different from marriage and family therapists. I would imagine different from a psychologist and different from a mental health counselor. So when you're looking for somebody you want to work with, Find the type of counselor you want to work with based on their education and their training too, because that will matter. Right? If you want to do couples therapy, you might want to work with somebody who specializes in that or has taken courses in it or done it for a number of years versus somebody like me. I've never worked with couples, right? You don't want to come to me for couples therapy, right? And I would tell you that, and I would refer you to a couples therapist or probably 3 or 4 so you can make a choice for yourself. But right. So just know that I know this is a lot to think about because you're like, gosh, I just want to see a therapist. Now I've got to figure out what kind of therapist and what's their theoretical orientation. What kind of therapy are they going to do with me? But you know what? No, you're going to be better matched if you look into those things ahead of time for yourself. It's part of that advocacy piece, as Josh mentioned.
Well, and I think that another question that I've asked, obviously I haven't been through the transition process, but for me, coming out was a later in life process, and I sought support around that. And one counselor I was interviewing, I asked, how many people have you worked with who are in my situation? And he said, well, maybe one. I was like, okay, well, I'm not going to be your number 2. You know, I'm like, you're a wonderful person, all that stuff. But for me, I need someone who's walked this road with people a lot more than that. And so their experience, in addition to training, you know, what you said, Stephanie, that your formal training hasn't been specifically in that in terms of your schooling, but it's through continuing education and lots of clients that you've come to where you are. And so it's, you know, what's your track record and how do I fit into that track record? I don't want to be your guinea pig, right?
Exactly. And if I can say one other thing, Josh, you know, consultation is a vital component of effective mental health care. And so is mental health professionals. When we're, you know, meeting with a potential client who wants to see if it's a good fit, that's a consultation. If I'm dealing with a case and I don't know how to handle something and I have a hiccup, I'm going to reach out to another provider and say, how can I handle that? That's a best practice in our field. For working with trans clients or specific populations, there's so much to learn that can't be handled in just a 15-minute call. So one of the things I did, like specifically, was I paid an individual who is competent in trans mental health care and had a lot of skills and background, and I met with them to just get feedback and discuss things. So that's something that you can do as a provider. Again, if this is a population you want to work with and you don't want to invest in a, you know, $1,000 program because you're not sure if you're going to really do that, there's ways that you can connect with some providers, but it's tough. We have big hearts as providers. I probably have most of my caseload on a sliding scale, which I'm very happy to do that. What doesn't make it easier is when other providers reach out and contact me and sort of demand me to provide an hour of consultation on their clients. So if you're a provider and you're needing to connect and really talk about things on a deep level or engage in training, really think about the ways that you do that and approach other providers, right? Like as a doctor, I wouldn't call up my surgeon and be like, how do I do, you know, heart surgery, right? You would be very clear about what you're asking for and consulting on. So there's a level of professionalism and skill that people are surprised that I have when I'm able to talk about diagnostic criteria and things like that. It's like, wow, you really know what you're talking about. Like, yes, I do. I've paid a lot of money for this training. I've done a lot of work. And so you can too, and trans clients deserve excellent care.
I think those are all excellent points. And as we're kind of coming towards the end of our programming here a little bit, I'd like to ask y'all to think about, you know, if there's one thing that you could say to a transgender individual who's considering therapy, what would that one thing be? And then if there's one thing you could say to the mental health profession as a whole, like, what would you say? What are the things that need to be communicated in your mind to both audiences to move forward and make progress? And whoever wants to jump in with that is welcome.
I would say for a trans or non-binary individual who is interested in getting counseling to just do it. It may be scary, but if you're not scared, I think sometimes we have to be scared to push out of our, out of this little box we're always in, color out of the lines a little bit. So I challenge you to just try and see what'll happen. It was successful for me. It's successful for so many folks. And understand that if the vibe isn't right, you don't have to stay. You don't have to go back. If they're telling you something that doesn't sit right with you, that's okay. You can find somebody else. For providers, I would say reassurance goes a long way, and that could be for any of your patients or clients. But for trans folks, we need to be reassured. I mean, and I'll speak for myself. I need to be reassured. I need to know that what I'm thinking is not crazy, that when someone makes me feel some type of way, it wasn't something I did. So just be patient with your clients and just reassure them and let them know that you see them and you hear them. That really will do a lot.
So I guess the biggest thing that I would say in terms of the community would be, again, with Nicole, like just do it, but also don't be afraid to ask. I know we already talked about this, but don't be afraid to ask your friends for suggestions of places to go. Just dive right in. And also, as far as the professionals go, I think just really, as long as we know that you're coming from a good place, we're not going to be upset with you. Don't rely on us to educate you, though. Just like Stephanie said, you're paying, if you want to be educated by another provider to educate you, you need to pay them. And just like if you want to be educated by us, we shouldn't be paying you for us to sit in the session and educate you. So just make sure that you go into it with enough information and enough knowledge that we don't feel like we're teaching you something.
So for people who are thinking about or wanting to go into therapy, I'll reiterate, what I said previously about, doing your own advocacy, your own due diligence around finding the right therapist for you. But there's also some other things you can consider, like how you want to see that therapist. Do you want to see them in person? Do you want to see them virtually? Do you want to do individual therapy? Do you want to do group therapy? If finances are an issue, look for somebody like Stephanie said with sliding scale. Look for centers that have options around subsidies like ACE was talking about. So there are even places where you can get free therapy, but be very careful because you want to still get matched correctly. Just because it's free doesn't mean you should jump on it, right? And just because it's $500 an hour doesn't mean it's the best either. And then for providers, what I would say is, so you could go to every training on the planet. You can read every blog, watch every YouTube video. You can watch every live stream out there, and I'll guarantee you, you're still not going to get it 100%. I don't get it 100%. Our community is not only diverse, we are very dynamic. And so we're a little hard to, you can't peg us down. Things shift. Right? The terms that people use on the East Coast are different from the West Coast. Terms that are used in the Hispanic community differ from the Black community. Younger people, older people, transgender, non-binary, people like, Ace and I, we use transsexual. I don't know if Nicole, you do, but we're all very different. So regardless of all that training and all that expertise and all that competency you have, it's still important to just be present with your client and use the terms your client wants you to use. Don't correct your client. I've actually had people who are providers, not my provider, but they're allies to me or colleagues to me, tell me I should stop calling myself transsexual. Don't do that to your clients and patients. We can use any term we want. Nothing is taboo if we're using it to identify ourselves, right? If I want to call myself a tranny, I can. That's my word for me. I've been using it since 2000. Don't tell me not to use that word. I'm not going to call Nicole that, nor Ace, but I can call myself that. So that's part of our authentic journey. We use the words we use. So that's part of the training sometimes is you'll go to a training and they'll tell you the do's and don'ts. Keep them in the back of your mind, but they're not hard and fast rules. And the language changes every other day. You'll never be caught up. So just know that. And it's okay. It's okay.
And to Xander's point, it's so true. We should be able to identify. However, I was oh my gosh, the messages that I got when I said that I had a sex change. They're like, we don't call it that. I call it that because when I'm in spaces with folks that don't understand the trans community, when I say I had a sex change, they understand very quickly what that means. So while for some people, and I would never say so-and-so got this, I refer to myself saying I got a sex change. But it's so true. And, you know, to Xander's point, it's okay to not know. Us in the community don't know certain things. I will be the first to tell you, I love my non-binary family, but there's certain things I don't know, and they educate me every day, and I'm thankful for it. So don't ever feel like you have to know everything. It's just about wanting to and continuing to grow and learn as you go on.
Yeah. Yeah, I would echo everything that's been said. You know, in terms of clients, a little advocacy piece here is if you encounter a provider who maybe it's just, it wasn't that great, I won't go back, and you don't need to spend time worrying about reporting them. But I am aware that there are people who really can do harm. And if you encounter that, talk to another trusted provider that you find. There are also, every state has ways to report harmful practice or unethical practices in our field. So that's available online, and it's important to know what's going on, and it helps paint a picture of who's safe in the community and who's not safe to refer to. And then in terms of providers, if you there's a big myth out there, and it's that a mental health letter is needed in order for transgender clients to begin taking HRT. That's actually not true. A lot of people, a doctor that you meet with may require you to get a mental health letter, but according to the WPATH standards, UCSF standards, a medical person who wants to begin hormones and feels competent in doing that can do so without a mental health letter. So there's much more emphasis on being present and being with the client and focusing on what they want than on you specifically doing kind of gatekeeping factors just for medical care. So it's very complex.
What I'll add to that, Stephanie, is that we don't necessarily need to go into therapy. We don't necessarily need the letters, but I can guarantee you, as somebody who's been through hormones and surgical, transition, there's a lot of information I didn't know that I wished I had known, that I could have gotten even just from my peer group. It was, this is the early days of the internet when I started stuff. So there's a lot more available now. There was no Facebook when I started hormones. And so part of it is, again, it's not that therapy. As a social worker, I'm more interested in the assessment, in the readiness and preparedness for, do you really know what it's like to take care of yourself or get somebody to take care of you after you've had a serious surgical procedure done? Most of us don't. We're not, physical therapists and occupational therapists and board certified surgeons and nurses. We don't know how to do that for ourselves. So being able to know like what's needed, how to prepare, how to be ready. And of course, we'll never be fully prepared or ready, but how to get as close as possible to be ready for any complications that come up, any disappointments, any post-anesthesia depression. There's all kinds of things that come up that we don't necessarily need a therapist for, but we should definitely have a good support network, and maybe have somebody that you work with that's like a non-clinical social worker or a nurse that's like a case manager at some of the programs that are around town, so they can help us with some of like walking through that process. With more education, more knowledge around that.
Yeah, I second what Xander's saying. I found that the groups online where other people have gone through these experiences have been far more impactful and beneficial to me when I'm going through something, mostly with mental health. I mean, if it's a medical concern, don't post it on Facebook. You got to talk to the actual provider. I see a lot of that. But if it's a mental health concern, or I shouldn't even say mental health concern, but if it's just like, hey, I'm going through this, has anyone else experienced this? More often than not, really, that you're able to find that through a group setting.
There's something so powerful when somebody else says, yeah, me too, right? Yeah, been there. Yes, I had that experience. And so it's affirming And it's a way of saying I'm with you on this journey. I haven't had the exact same experience, right? Because you're you and I'm me, but I've been in the neighborhood, and I get that. And so that's really powerful. So I just love these conversations that we've had. I love this topic. I love y'all for the work that you're doing and showing up and being advocates and leaders and healers and helpers. It's been a beautiful conversation. And as we're wrapping up, we were going to just highlight some of the resources that we've mentioned before. So some of those are going to come up on the screen. And if there's any that you have mentioned and they don't come up, let's feel free to say that again. So the American Trans Resource Hub, Xander, you've got a booth at Pride, right, tomorrow, so people can come by and talk to you in person. It's
That's
exciting.
right.
And then there were a couple others: World Professional Association for Trans Health, WPATH, and there were others as well, I think. Were there any others that y'all mentioned that you would like to re-emphasize?
I think it's some interesting data points for listeners to get some more information on. And at transequality.org, you can download the PDF summary of the 2015 National Transgender Survey, which included components on health and mental health. And it's the largest data set of transgender individuals in a survey conducted in the US. So
well, they're
really
repeating
good to look
it.
at. Mm-hmm.
They're repeating that study in 2022. I think they're going to start another round of it. Yeah.
Awesome. I love that. And then trans equality. Sorry, go ahead, Xander.
I don't know, Stephanie, if you've come up with this, but Stephanie and I do similar work for an organization. And one thing that's been coming up since around May, I've heard it multiple times now. And so I want to put it on the therapist registry as well, which is that there are a number of trans people, non-binary identified people who started hormones during the pandemic. These are people who have not integrated into the community at all. They haven't gone back to the office. They haven't gone back to get their coffee at their local place with that barista they used to always see. They have no idea how it is they're going to navigate this world after being on hormones for 9 months, 12 months, 16 months. Some of them are going to be very changed people in the way they look and sound. And they didn't have the opportunities that Nicole and Ace and I did, which is we changed slowly over the course of every day in front of people. These are people who just are going to be totally new to their family, their friends, and their peers and their colleagues. And so we need to be able to find a space for them. They need to be able to come into the community. They need to know where to go because it's a very, very different experience than what we've had.
Mm-hmm.
That's true. We've been in a COVID cocoon, right? And now you're coming out and you're spreading your wings, but you're going to need plenty of support. Yeah. And I really appreciate y'all, and I appreciate the resources that you're sharing. And if anyone's watching this today and needs additional support, we would encourage you to reach out to any of the organizations that are represented here today. And we will connect you with whatever support we can, because you're not alone. And there is so much that is out there for you to support you in being who you are. Translifeline.org is another resource that Stephanie's mentioned. Definitely look there for additional support. Just a reminder that the National Trans Visibility March is tomorrow at 2:00. And it's going to be following a rally at 1:00. So if you want to be in the march, anybody's welcome. Transgender folks as well as allies can march in the march with us. Come to the rally at 1:00. It's at the northeast corner of Lake Eola. So kind of that intersection of Robinson and Neola Drive, that big green space, there will be a stage there. Come to the rally. You're going to hear some amazing speakers. And then we're going to turn and we're going to march the parade route, the Pride Parade route in reverse. And the energy, I can already feel it. I'm already thinking about how good this is tomorrow for everybody to show up together. So looking forward to seeing you there. You can also find more information at nationaltransmarch.com on other events. And so we would encourage you to check that out. Please take the time to share this video on your social media. This has been a beautiful conversation, and we want to make sure as many people as possible get to benefit from this. So thank you, everybody, and have a wonderful rest of your day.
Thank you.
Wave it. We wave.
We're waving, Josh.
Over the past few months in the Washington, D.C., Maryland, and Virginia areas, the Black and Brown, queer, transgender, and non-binary communities have experienced multiple different losses to substance use. Individuals directly and indirectly impacted by this issue all came together as a part of the National Trans Visibility Marches Community Advisory Board to create a campaign to raise awareness about this issue. Those individuals created a campaign titled Our People, Our Purpose. The message behind this campaign is meant to promote the necessary community that individuals need, family, chosen family, biological family that individuals need in order to make sure that they stay safe.
It would mean unity, and it would mean change. It would mean change because the one thing that's the problem in our community is division. And coming together, we would make such a powerful impact on the world as a whole, just being one.
When I say trans, you say power. Trans, power. Trans, power. Trans, power.